It's my pleasure to introduce our first speaker of today, Andrea Amico. She is a co-founder of the Testing for Peas Community Action Group. She started advocating for more answers and action for the Peas community impacted by PFAS water contamination at the former Pease Air Force Base in Portsmouth, New Hampshire in 2014. This was after she learned her husband and 2 small children were impacted by highly contaminated drinking water. She is passionate about raising awareness of PFAS water contamination, providing communication to impacted communities, lowering standards for PFAS in drinking water, and collaborating with others from all aspects of PFAS, that is, including communities, physicians, legislators, researchers, government agencies, and more, and all to achieve a common goal of reducing PFAS exposure in impacted communities. Testing for PFAS advocacy was instrumental in securing a PFAS blood testing program and 2 PFAS health studies for the PEAS community, the CDC ATSDR PEAS study and the PFAS REACH study with Silent Spring Institute. Andrea testified at the first hearing in the U.S. Senate on PFAS in September of 2018. She was awarded the Citizens Excellence in Community Involvement Award by US EPA Region 1 in November of 2018. She also attended the President's State of the Union address as Senator Jeanne Shaheen's guest in February 2019 to raise awareness on PFAS contamination. She is a co-founder of the National PFAS Contamination Coalition, which formed in June 2017 to bring PFAS advocates from all over the country to organize for change at the federal level. She helped to organize the first 2 national PFAS conferences held at Northeastern University in Boston. In June of 2017 and June of 2019 were those conferences. Then in September of 2019, she gave a TEDx talks on PFAS, which was titled PFAS and a Mother's Journey to Becoming a Clean Water Advocate. And in November 2019, she presented at the CDC's first public health grand rounds on PFAS in Atlanta. Andrea serves on the PEAS Community Assistance Panel with ATSDR and has been a member of the panel since it formed in 2016. She is a community co-chair of the PEAS Restoration Advisory Board with the U.S. Air Force. She's also a community co-chair of the City of Portsmouth Safe Water Advisory Group and community partner on the PFAS REACH health study, researching PFAS levels and immune function in children in Portsmouth, and Hyannis, also in Massachusetts. When Andrea isn't committing her free time and passions to PFAS advocacy, she is spending time with her husband and 3 children in Portsmouth. Andrea has a master's degree in occupational therapy and works for a neurological rehabilitation hospital, where she helps facilitate rehab for patients impacted by strokes, brain injury, spinal cord injuries, and other major illnesses, helping them to recover and regain functional independence. And with great pleasure, I turn things over to Andrea Amico.
Thank you so much for that introduction. I'm just going to share my screen to bring up my slides. Can everybody see my slides okay? Okay, great. Good afternoon, distinguished members of this committee. I'm pleased to be here and share with you the community and patient perspective on PFAS testing and health outcomes from the viewpoint of a PFAS community leader. I won't reintroduce myself. I appreciate the very comprehensive introduction I was given. But I will start with my story. My PFAS story started in May of 2014. Prior to then, I had never heard of PFAS. Back then, we were actually calling them PFCs. But I was devastated to learn that my family had been exposed to highly contaminated drinking water at the Pease Trade Port in the city of Portsmouth, New Hampshire, which is home to the former Pease Air Force Base. I was especially worried about my 2 young children, then 1 and 3.5 years old, pictured here, because they were exposed to highly contaminated drinking water at a daycare facility they attended at Pease. They were in critical stages of their development, and my heart sank, wondering how these chemicals I knew nothing about and couldn't even pronounce would impact their health in the short and long term. And even today, more than 7 years later, since my life changed forever, learning of their exposure, I still don't know what the health impacts will be on my family in the long run. And despite many more communities learning of their PFAS exposure and the significant increase in scientific studies on PFAS, I and millions of Americans across the nation still don't have clear-cut guidance from public health agencies on what we can do today to be proactive and monitor our family's health in the setting of a significant chemical exposure. My goal for today is to share with you the benefits of PFAS blood testing in my community, the questions PFAS impacted community members have, the challenges they face, and the solutions they need related to PFAS testing and health outcomes. In 2014, I quickly educated myself and organized with 2 fellow moms, and we formed a community action group called Testing for Peas. Because we learned that PFAS bioaccumulate in the body and have long half-lives, we wanted a PFAS blood test to quantify how much of the chemicals were in our family and in our community. In the spring of 2015, our state health department in New Hampshire did initiate a blood testing program to the exposed community. Almost 2,000 people participated in the blood testing program, and sadly, the results revealed elevated PFAS levels when compared to the general population. This led our community to ask how these high levels of PFAS in our blood have or will impact our family's health. Our state and federal health officials could not answer those questions. And so we then advocated for PFAS health studies in our community to learn more. With a lot of persistence, continued organizing, and strong relationships with our congressional delegation in New Hampshire, we were able to secure the first in the nation PFAS health study at Peas with ATSDR, and another children's PFAS health study called PFAS REACH, focusing on immune function with Silent Spring Institute. The Peas study now serves as a pilot to a multi-site health study ATSDR is coordinating in 7 other communities across the nation. Our advocacy resulted in PFAS blood testing, and the results of those blood tests resulted in 2 PFAS health studies in our community, which paved the path for 7 other communities in the multi-site study with ATSDR. So, information is power. Power leads to action, and action leads to change. Do not discount the power of PFAS blood testing. Being exposed to PFAS generates a lot of questions. I know I have spent countless nights awake pondering these questions, and I feel it's important for the committee to understand the community questions as we are looking to you and your work to help establish guidance that will answer some of these questions. The list focuses on health-related questions community members often pose to their healthcare providers after learning they've been exposed to high levels of PFAS. In the interest of time, I will not read them all, but I hope the committee will. The general themes from the questions are around: how has my health been or will be impacted by PFAS exposure? Can I test my blood for PFAS? And what can I do now to take control of my health and monitor for health effects while reducing my exposure? PFAS communities face many challenges when trying to better understand their exposure. Keep in mind, they have often been exposed to a mixture of PFAS, not just 1 or 2, for a significant period of time. And a lack of federal regulations means that ongoing exposure to PFAS is still happening today, right now, in some communities. Impacted communities don't usually have access to PFAS blood tests because they're not generally covered by insurance, are expensive to pay for out of pocket. Physicians don't know how to order the blood tests through limited labs that provide the service. And PFAS blood tests are overall not supported by the healthcare community, who does not see the value in obtaining blood test results on something they feel won't tell their patient anything and will likely cause anxiety or worry. The reality is, impacted communities already have anxiety and worry. And by denying them access to a PFAS blood test that will actually help establish a baseline and empower them to make informed decisions, to advocate for more action, that denying them only adds to their anxiety, worry, and anger. And PFAS blood tests could lead to more communities advocating for health studies and more strict regulations in drinking water, like I did in my community. And how will the scientific and medical community ever know if PFAS health effects and associated blood levels are related if we don't test for it? We have to start somewhere. So why not give access and some sense of control to the very people who had no say or control in being contaminated in the first place? And the cost of PFAS blood tests should not fall on the shoulders of communities who already bear the brunt of significant costs, but rather to the polluter or insurance companies. This also means more commercial labs should be and need to be offering PFAS blood testing to make this testing more accessible and more affordable. A huge challenge faced by PFAS communities is the lack of physician education and awareness of environmental contamination. These studies and article discusses the lack of training and preparedness physicians have in the area of environmental health and how to screen their patients for environmental exposures. And this article from the Association of American Medical Colleges breaks down the lack of education and instruction medical students receive while training to be physicians. Most notably, nearly 1/4 of schools surveyed did not require any environmental content. This gap in knowledge and training for physicians creates roadblocks for impacted community members seeking knowledge and guidance from their healthcare providers. And that leads me to my next major challenge, that physicians and healthcare providers then look to trusted health agencies such as CDC and ATSDR to provide them education and guidance on how to answer questions for PFAS exposed patients and what to do to monitor their health. Unfortunately, the current ATSDR physician guidance document is way too long, and it includes information that is dismissive of community concerns, contradictory in some places, and does not provide clear guidance to physicians or community members on how to monitor their health. There is also a general lack of guidance and counseling for breastfeeding and pregnant women. We know through scientific evidence that this sensitive population is impacted by PFAS crossing the placenta and transferring to infants through breast milk. Women deserve to be individually counseled on PFAS exposure pathways, potential health effects to both mom and baby, risks and benefits of breastfeeding, and be allowed to make individual informed choices, yet we have not seen this sensitive group prioritized in public health guidance. Overall, the lack of education and knowledge on environmental health and the subpar guidance from our public health agencies have left local healthcare providers and impacted communities without a clear path forward. Often communities are more of an expert on PFAS than their providers, many who have never even heard of PFAS. And this lack of awareness often leads to community members being minimized and dismissed by healthcare providers, and that limits access to an informed discussion and a clear path to monitor health. Parents in my community have been denied by their pediatricians access to additional lab testing for their children because of the current confusing guidance. This is dangerous, as PFAS has been associated with significant adverse health effects that impact multiple systems of the body. Leaving communities and their providers without adequate guidance and resources means diseases and health effects could advance without notice and cause debilitating and chronic health conditions, if not death. There are some clear solutions needed by PFAS community members that fall into the scope of the work of this committee. PFAS communities and healthcare providers need clear, concise PFAS medical monitoring guidelines. A wonderful example is 2 documents established by the PFAS REACH team, which I am happy to be a part of. I hope all of you have seen the guidance documents recently released last month, and if not, I encourage you to please read them. In addition to PFAS medical monitoring guidelines, communities need access to PFAS blood testing to establish a baseline and to monitor for drops in their levels over time if they or their doctor decide that is best for them. As I said earlier, the cost should not fall on impacted community members, and commercial labs need to offer these tests to improve affordability and accessibility. We also need to see improved outreach to local providers and highly exposed community with accurate information. It is not okay that providers are hearing of PFAS for the first time by their patients. And we need more emphasis placed on environmental health training at the medical school level. We need more focused attention on sensitive populations such as pregnant and breastfeeding women that require individual counseling of all risks and benefits to make informed decisions. And please keep in mind that subpopulations and environmental justice communities may require additional support and education and may not rely on traditional mechanisms such as doctors' offices to obtain access to health. Due to the significant increase in much needed studies on PFAS and human health, a plan needs to be established to update and provide ongoing education to providers as we learn more about PFAS exposure. What recommendations are made today will likely change in the future as we learn more. So establishing a plan for ongoing education to healthcare providers and local communities is critical. Lastly, but most importantly, we need to act with a sense of urgency. Communities need medical monitoring guidance now. We have been exposed for decades. to a mixture of these toxic chemicals, and some of us continue to be exposed. We must not wait anymore and continue to kick the can down the road. Communities need access to clear guidance to take control of our health so we can monitor, diagnose, and treat adverse health effects early on. It is the single most effective tool impacted communities need today to help address their PFAS-related questions and concerns. I will close by thanking the Academies, the committee, and the sponsors for convening this panel and working to address this very important issue. The 3 community town halls were very impactful and represented a diverse group of community voices. Thank you so much for giving so many members of the community a platform to share their stories and highlight their needs. PFAS contamination is a complex problem impacting every state in our nation. Communities have many questions and face many challenges. We need access to PFAS blood tests. We need access to clear and concise medical monitoring guidelines, and we need access to informed healthcare providers so we can establish a plan to monitor health. Lastly, this committee is in a position with a significant amount of power. This country is looking to you to review the science, hear from stakeholders, and make meaningful recommendations. Your work is critically important and has the ability to fill a significant gap to improve the quality and the quantity of life for so many communities across this nation, many who you have directly heard from. Thank you for your work on this very important health issue, and thank you for letting me speak with you today.
Thank you so much, Andrea. That was excellent. We have about 2 minutes left for any initial questions, and Andrea will be here, I think, through the rest of the session to answer questions at the end of the panel. But does anyone have any questions for Andrea at this point? Andrea, it doesn't mean we won't.